Man, I love the or live, but I love the prominent. It's not quite a mustache, but it's like a prominent, caterpillar on the lip.
Accentuated.
So
The
yeah, yeah, yeah.
accentuated mustache, they say, yeah.
What's it called?
I don't know. It's funny how it started. I've had a beard forever. And then when COVID hit, we were at school and the IPC lady came up to me and she's like, so you guys have to do N95 fittings and you're gonna have to lose that beard. And I was like, there's no way. Like I can't, like I've had this beard since whatever, grade nine. Like I don't even know what I
I've been
look like.
growing it since grade nine. Okay, I
And I was
like it.
like, there's no way I can get rid of this. So I was like, well, is there any way? She's like, well, you can have whatever fits underneath an N95. So I was
Oh,
like, okay, well, it's Movember at the time. So I was like, well, I'm just gonna keep the dirtiest mustache of all time. So I trimmed everything down and had the longest mustache and just kept it since and kept growing it out. Got positive reviews. So I've just been riding it out since then. But
wow. You got the girth.
the
Like the
girth, eh?
mustache has the girth. Like I can't get that
We're
kind of
still
girth.
talking about mustaches. Okay, okay.
Yeah.
Like mine is like very thin, as you can see. You have like yours basically covers what's this called? The nasolabial fold.
Oh yeah.
Yeah,
Yeah,
yours goes all the way
it
out
took some
there.
time. You gotta like kind of it's like a haircut, you know. If you're growing it out, you gotta like grow it, trim it back a bit, grow it up, and like build up that thickness.
Nikki, what do you think? What do you think of his stash?
I have nothing to add to this. Nothing to add to this. I think facial hair is disgusting. My girlfriend loves the 3 day shadow. I've noticed 3 days, 5 days, too far, too far. They won't let you on a plane.
Have you
Three
ever had like a
days,
beard? Have you ever had like a full beard or anything?
no, hell's no, no. I
No?
don't like it. Man, I don't know how you guys do it. I'm always itching underneath my mask, and I don't know, man. It's not for
I'm
me.
scared to see what I look like if I take it off. I don't know. I don't
Yeah,
know
me
how
too.
long I'll be.
Yeah, me too. For
Damn,
my
man.
N95, I did the handlebars, and my girlfriend's like, "You look like a porn star." I
Oh,
was
that's
like,
awesome.
"Success."
You
I
have
mean, it
you
worked.
have to post that on the Instagram at some point if you have a photo of that.
Oh, I do. I have plenty. I think she has more of me than I have of me, but it was quite
That's
the
usually
look
how it
for a
goes
good
though.
3 months,
Yeah.
or 3 weeks.
You
Sorry.
two just bromancing over here about facial hair. I love it.
You can't even. How do you even curate a 3 day shadow? Because you could either go zero or like a week. So you just have to cut it
No,
back all.
dude. I see her on Saturday, so I just stopped shaving Wednesday.
But how do you go from 5 day to 3 day? I feel like you can only go from 5 day to zero, and then you have to build back up to 3 days. Like the
Oh
blades
yeah,
don't
that's
go short
exactly what
enough
it
to.
is.
Ah,
Dude,
okay.
it's that's exactly, dude. I don't see her, like, we don't live together. Like, she lives in a different city. So Wednesday I stopped shaving. That day three is Saturday. I see her. Perfect shadow. Day four, day five, Sunday, right? And then shave it off for work Monday, Tuesday, Wednesday. I'm ready to go again, man.
Like, don't you find it to be a huge pain in the ass to shave your beard every day, like with a razor? Isn't that just like an absolute time suck?
Yeah, man. That damn hygiene, man. I find brushing my teeth is a pain in the ass too, but we all do it,
Yeah.
right?
Do
Yeah.
we?
So,
Up for debate. Up for debate. But Kyle, man,
Oh,
you're
so Kyle,
yeah, you're straight out of school. You're in. Tell us about your journey so far.
I don't know. It's been interesting. I definitely am not quite in the role that I saw myself being in. I ended up meeting the people that I work for actually at I think it was the Sinclair, the Henry Schein kind of speed dating night, they call it, where they have a bunch
oh
of
yeah, I
yeah, they have a
remember
bunch of
that.
different practice owners that are looking for associates and they put on a bunch of food and drinks and you come and you kind of speed it. You go group to group to group and just chat and talk about job opportunities. I was like, oh, I don't know. It was midweek or something. I was like, I don't know if I'm gonna go to this. I don't know if it's my thing. Like I'm pretty busy. Maybe I'll just drive myself. I'll hang out for 5 minutes. And then it got kind of disorganized. So everyone was kind of out of there's maybe 30 groups there. I feel like most people probably saw about eight or nine different people and kind of spoke with them. So I happened to sit at this one table where I was like, oh, these guys look pretty chill. So I sat down, chatted with them, and we kind of just hit it off. And then they invited me out to their lake and we went boating and stuff and hung out. And turns out they had just got a new clinic out in Leduc. And I've got family in the Southwest and in Beaumont, played hockey and stuff out in Edmonton, rural Alberta, tons growing up. So I kind of was familiar with the area. So I went and stopped by and they wanted to take me on, but they were kind of saying that this is going to be a pretty hands-off role. You're going to be more or less alone out here with not a ton of mentorship. But the good part about that is that it's going to be kind of your deal to do what you want to do with it and take it your direction. So I've
Yeah,
been working out there for a year now since last July, actually, and lots of learning curves, right? Lots of speed bumps that you come across in your first year out, but everything's manageable. But I've learned tons about the business side of things with them, but also just about being an associate and working in dentistry, which is nice.
But Kyle, man, you don't know what you don't know.
Yeah.
Do you know what I mean? Like
Oh yeah.
it's like the blind leading the blind here. Like, how are you supposed to know what you're supposed to be doing? How do you know what's acceptable? What do you do if you're in trouble? I'm just going to be honest. I hate when people do this. Like, I hate when owners, they're like, oh, I'm just going to build a new clinic, stick an associate in there. They stick a new grad in there. And with all due respect, Kyle, like, you don't know what you don't know,
Oh
man.
no.
Like, you're going to get
I'm
into trouble. And I know you've been into trouble already.
oh
Like,
yeah.
what was your mentality behind like saying yes to this agreement?
So, and that was the first thing I brought up to them when they kind of said that. I was like, so like what do you mean? Like, I'm just gonna be solo kind of deal. But the people that own it, he has a clinic in Wetaskiwin, so they're not too far. And he's been really good about, you know, like when I first started there, he was in office doing some office stuff a few days a week. So he was around for to give his perspective and, you know, give a hand where needed. But you know, and like now he just comes into office whenever I have a big case. So if there's a certain, you know, if we're pushing the limits on, you know, I want to try a new procedure, or if there's a case with more complicated wisdom tooth exos or something, we'll plan that ahead and he'll come in and give some mentorship on that. He's also really available as far as consulting with cases and stuff. It is a bit of a, you know, you have to really lean heavily on case selection, I've found, right? And not getting
Yeah.
yourself into deep water, and just making sure if there's a case that you're questioning, you know, reaching out beforehand to go through the merit of the case and the different details with your colleagues to make sure it's a case that you can manage, whether it be ortho, endo, you know, exos, whatever it is, and just make sure that that's something that is attainable, and making sure that the patients know that as well. But it does sound more hands off than it is. It's somewhere in between, I guess, but it is something that I was also looking for, because I also know some people who work under, you know, in different setups where there's multiple associates or a very overbearing owner that kind of says, this is how we're going to do things, this is the way, which has its own benefits, right? Because you have a lot of help. But I also knew I wanted some independence to try to really develop that. But it's definitely been, you know, there's some stresses there and some growing pains, but it's been good overall, I think.
So everyone, I feel like in Southern Ontario or like Southern Canada, um, knows that you earn more being a rural or in our case, we call it like a Northern Ontario dentist. You know, it's just basically anything north of like an hour and a half out of Toronto. Why do dentists in rural areas, and I think Neki, you would have a lot of light shed on this. Why do dentists actually make more not practicing in the GTA? Is it patient flow? Is it quality of patients? Is it like what is it?
I mean, like you said, I'm sure Neki knows, he's got tons of experience in that kind of domain. From what I've seen in our clinic, it's not as much, you know, it depends too. Like, it's not like people are coming in saying, I want canine to canine veneer fixed, or they want, you know, like implants, and a lot like that does come through it, but you don't quite see it as much. But I think one thing where I see it a lot from, you know, where it varies from some of the city clinics, with just from the small, you know, sample size that I have, having discussions with some of my classmates and other people I know that might be a year or two out. One thing that we see a lot of is like quadrant dentistry. So people that'll come in that need, you know, from, you know, canine to 7 of restorations. So you're anesthetizing one quadrant, you're able to do multiple services all in one go with one patient, rather than having to do, you know, like a single DO or a DOMO and then you move on to the next patient. So that kind of, you know, as far as caseload and work that you're doing a lot per patient often, but it really just depends too. Like, it is a bit of a different profile of what type of work you're doing often, I think, than if you picked certain clinics in the city, but it's so variable depending where you're at.
Yeah, I find it's so tough. Like, I guess I'm kind of biased. I've only worked rural. I've never worked in the city. I just hear lots of stories. Um, what do you do when you get in trouble though? Like, Leduc is different. Leduc is like what, 20 kilometers outside of
Yeah,
Edmonton. I don't know
I
if I
wouldn't even call it
consider that.
rural. No,
That's not rural, man.
no,
No.
no.
But like, say you're in Northern Ontario, I'm 2 hours. Like, I don't even consider myself that rural. And yet I'm 2 hours from Edmonton, 2 hours from Saskatoon. If we get into trouble, like, what do we do? Do we call the hospital? Because they don't even have, like, the hospital ends up calling me if there's an issue, right?
Yeah.
And for me, that's the downside of being rural, is like you have like a dental emergency, like, you're taking out a tooth, you have an arterial bleed, life sucks. What do? And you realize that there isn't that supports in those communities. But on the other hand, you do have so much opportunity, like you said, like you get to do a lot more procedures. You get to really build up your dental resume because you do get a lot more experience. And I think that's worth it. Like I feel like combined with mentorship, rural dentistry, only with mentorship, works well. If you're
Mhm.
rural dentistry on your own, I just don't think it works.
But in
I don't
particular,
know.
the
What
money
do you think?
aspect, how does
Yeah,
that factor in? Because the only people that I know want to go rural are the people that want to make more money and pay off their student debts faster. So like, how do rural dentists make more money?
I guess it depends. Like Neki said, where I'm at, it hardly qualifies as rural. It's not really, it depends. The people that are definitely centered in the city, they might find it to be rural because it's a bit of a drive out of the city, but it's really not far at all. Um,
yeah.
Man, I consider anything I can't walk to rural.
yeah,
So
yeah,
Man, typical Toronto, am I right?
yeah, yeah. No kidding. Like
if it's
to
not a
me, like
stop on the subway, it's rural.
like
Yeah.
anywhere you live in Edmonton, you can pretty much drive to downtown in half an hour. It's like it's not quite the same as Toronto out here, but
Yeah.
I think a lot of, and I don't know, this might just be what I'm seeing, but when you are rural, and from what I've heard, and we see this a little bit when we do our rotations through some of the northern clinics when we're in school, we go up to McLennan and stuff like that. Um, Case acceptance often when not for some of the major stuff, but for just generally, getting work done in general is fairly high because patients don't necessarily want to go all the way to the city, or they don't want,
That's right.
they want to get it fixed then and there, and they want same day, and they want some treatment, they want some help. So you usually have to do a ton of convincing because they've came to you for a reason and they're looking to get treatment. So that plays into it a bit, I think. But I don't know, maybe Neki has more insight on why, how the finance all rolls out for that.
Man, you just get to do so much more in dentistry. And you're totally right. Patients want treatment. They don't want to drive 2.5 hours to the closest specialist to get treatment done, which is a pro and a con, because then I feel a lot of rural dentists take on cases maybe they shouldn't. And I'm looking in the mirror when I say that. Like I full-heartedly agree. I have made mistakes and I continue to make mistakes. But when patients say, you do this or it's not getting done, and I'm just going to suffer, like you just jump in and you do the best that you can. And patients are, they're very understanding. But I find I wouldn't work in a city just because I love rural dentistry. And it's not so much about the production or your ability to do more dentistry. It's the relationships that you make. And it's the relationships that you get to make with your staff and your patients. And it's more of like a tight-knit family. Like the same kids that I coached in basketball, I'm now pulling their wisdom teeth like 13 years later, right? It's those type of relationships that is awesome. Like Akil, when you go to the grocery store, do you think you will ever see your patients? No. I see my patients every day whenever I go to the grocery store, I go to the gas station, or you go out for dinner, and people wave at you, and it starts to get annoying after a while when people are like lifting up their lip to show you their tooth, and you're like, haha, yeah, I know I'm your dentist. But
Yeah.
no, man, it's fun, man. I like rural. Would you ever go to city dentistry, Kyle?
Ironically, when I was looking for my first job, the second option, or the competing option that I had, was literally downtown. So polar
Hmm.
opposites of what I'm doing.
Downtown Toronto or downtown
Downtown Edmonton.
Edmonton? Okay.
Yeah.
Okay.
So if you qualify that as a true downtown, but
It
um,
counts.
so it was slightly different, and it didn't work out just for other reasons. It wasn't quite exactly what I was looking for as a job, and just the way that, as far as room to grow into the position, it wasn't quite there with just the size of the clinic and what I was looking for. But I would work in the city, I think. I do like, when you're saying you got to meet some of the nicest people and you get to know all your patients. I've met some of the nicest people ever out in Leduc. Not that you wouldn't find any in the city, but it's been a really nice place to work. Everyone's been super accommodating, super nice. And like I said, growing up on the south side, having family in Beaumont, which is just outside of Leduc there, it's a French community. I've ironically ended up treating multiple patients who knew my grandparents and just through the system,
Yeah.
kind of knew each other. And who would have thought that however many years later I'd be working in Leduc at a clinic I've driven past probably 50 times and I never even knew it was there, and then end up treating patients that I've known from before. So it's a really small community and cool to be part of, and it's nice to kind of give back that way on the tail end of things.
You mentioned your business acumens. Like how has that blossomed?
So that's one of the nice things too, is so on the clinical side, he's a mentor that's in the office and out of the office, so have to manage that on its own. But as far as day-to-day stuff, his wife, she managed for years and years their clinic in Wetaskiwin and helped grow that, but also managed a clinic in Tofield. So she is actually in the office every day except for I think one day. So she, as far as where we wanted this clinic to go on the clinical side, and what cases, what materials, what procedures, and how we want to run that and all the flow. She's also really invited me in to be part of the process of building this clinic back up since they've acquired it. So how we want to run the social media, or how we want to do, roll out Invisalign or certain case things, and how we want that to flow through the clinic. And she's really shown me kind of also some of the behind the scenes of how it works to manage staff, which is a whole thing that, when you're in dental school, they really hammer home clinical and how much bond to use, what matrix system, and all these things, but you don't get a ton of actual usable information on clinic management, how to manage staff, how to build a clinic, how to manage patient relations when a patient is upset or doesn't, there's an issue there. Like, how do you manage all those side of things? That's a whole nother part of dentistry that I think often gets, you kind of have to learn just trial by fire once you get out. And it's been nice to have a mentor on that side as well that's actually invited me in and helped me grow there.
So Kyle, I find it interesting, and I know that there's two sides to this argument. As a business owner, I know that it's, it costs a lot to buy a business to run the office, staff, equipment, yada yada. I hear it. But like, you're essentially, like, on the other side, like, you're essentially running this person's office for them. You're building up their goodwill, you're building the equity in this office, and you're not necessarily paid for any of that.
For sure.
And when that person decides to sell that office to corporate, you're not going to share in the profit of that. How do you feel about that? And I know, like, I hate it when people say, like, no one ever talks about this subject, so let's just talk about it. Like, do you feel a little, I don't know, like, jaded inside that you're like, well, I'm building this office for you, homie?
I, to some extent you do think like, if I'm doing, if there's work to be done and we're trying to figure out, okay, how to roll out this new, this new thing, and you're like, oh, I've got to put in all these hours after work and manage these things, and you're always on your phone and always, fielding calls and trying to figure it out. Part of your mind does kind of wander there and go like, oh, well, not exactly getting compensated for this, but indirectly, in a sense you are, because as you grow a clinic, your patients are happier, they get better care, they come back, all those things. But on the, direct financial side with your question, they're like, we have had this conversation, before, and we've talked about it a lot. And they said, whenever you're ready, if you want to buy in, if you want to buy out, whatever your kind of interest is in this area, we're completely open to exploring options with you. And
that's good.
They're transparent with showing the numbers and where the clinic was before they bought it, where it is now, how it's growing, practice valuations, all that stuff. Like, they're very open to that. And they have said, as soon as you're ready and want to, like, we're more than welcome to have you come in and, take a piece of this and be part of it in the big picture.
It's a good way to look at it. I almost look at, man, I was sweating Neki just from Kyle's point of view, just listening, think of his boss listening to this, just putting him in a spot.
No, man, dude, how can you not? How can you have to have that in the thought of your mind as a business owner, as an associate? No one talks about it. Just be open about it.
Totally. Well, the clinic
just real,
down the
right?
road, and the clinic just down the road from us that, they've been in practice for forever, like as long as this clinic has been as well. They just sold out to corporate as well. So we're waiting to see kind of how that's going to happen, because almost, very shortly after that, a staff member had left, and, things start to change. And, I'm not saying corporate's the end of the world or the worst thing ever. There's obviously, you can debate that forever, and it's been debated at length and in many different ways. But it is one of those things where it is in the top of your mind, right? Because you're also, as a new grad, you're thinking, okay, this is my career right now, but it's also going to be my career for the next 20 years or so, or whatever it is, right? So you have to think a little bit long term in terms of where do I see my career going, and what do I want to build for myself.
Interesting. Yeah, I almost see it from the other angle too, where I'm like, you're lucky because you get to learn on someone else's dollar. Versus if you were to buy yourself, your every single decision you make is, monetarily like affecting yourself. But I'd want to know just from that perspective of kind of learning and sort of seeing for the first, because you're just over a year out, or just about a year out. What's the biggest lesson that you've learned that sort of, took you by surprise?
There's too many to name. I think the biggest part is, as funny as, again, when you're in dental school, a lot of the focus is on the minutia of dentistry, right? Like the variances in bonding and all the little tiny details, and what, how much degree of taper does your crown prep have, and all these things, which is good, right? Like you need to do excellent dentistry, and your patients deserve that. But I think at the forefront of everything is, as people would always say, put your patients first. As long as you prioritize the patients, everything else will kind of fall into place. And I think that's actually very, very true. So many times, and Neki, this is actually something that you touched on at your lecture in PDC, where you said, all these cases I'm showing where there's mistakes or things that didn't go as planned or they're non-ideal. These are all my own cases. Like these are all things I've done. And he's like, these are all patients I've made mistakes on. And all of the patients, when you show the after photos, whatever, they're all smiling, right? Like none of them are like mad at you or hold it against you, because if you put the patients first and you truly have, their best interest at heart, they feel that, they notice that, and that's going to just have so many downstream effects in your dentistry and how they see you and how your long-term relationship is with that patient. I think that is one thing that I learned, that whole greater picture is much more important, and or equally as important as just the dentistry you're doing at the end of your loops and what you're seeing in the mouth.
I totally agree. What do you think is like an area that you feel like you want to grow into? So like we're all going to make mistakes, but like what, as a new grad, you're kind of out now, like what areas do you want to grow into?
In the short term, it's about getting more consistent and increasing your pace in a way that's reproducible, and things like endo, exos. Like you can complete it, you can do these things, you take your time, have good outcomes, but at a certain point there has to be a point where you can do it and it doesn't, throw off your day or throw off your schedule. And then that's also, just skill with case selection, right? Like being able to look at rads and know, okay, yeah, this is something that's going to take me this amount of time, or this is something that's going to take me, it's something or maybe it's something I shouldn't even do, right? I should send that over to Neki and have him pop them out. I shouldn't be touching these. That's another thing that you learn a lot, in the first 6 months probably, is I was way overbooking time, because you come out of school and you have whatever it is, 2.5 hours to do a DO, right? Because you're getting all these checks, all these things. And then you come out and you're like, hey, I'll dial that back, and you book whatever amount of time. And then you're sitting in the office going, okay, well, what do I do with the rest of my day? I got holes everywhere, right? So as you start to kind of narrow that down and get a feel for what your hands can produce and what you can do in dentistry, it's always changing, but I'd like to obviously, keep working on that. But I think when you're saying, what areas do I want to get good in right now, it's those main things, right? Getting good at taking out wisdom teeth, because you'll see a lot of that in Leduc, and general dentists should be able to provide that and a lot of that to their patients. And then, endo, eventually getting into more of the, implant stuff, to be able to offer a wide range to patients, because in Leduc, that's the other thing, is you do see a little bit of everything. So I think it's really important to be able to offer a little bit of everything to your patients.
I'm going to put you on the spot here. Really quick, without even skipping a beat. I say corporate. The first thing that comes to your mind is what word?
Dental Corp.
Dental Corp. Where has corporate gone so wrong? Because I always think about it like philosophically. Philosophically, there's a lot of good arguments for corporate, and there's a lot of bad arguments for corporate. But why is it, without skipping a beat, every dentist has the same perspective on corporate unless they're cutting you a check?
It's tough
Oh, dude, you nailed it. Unless they're cutting you a check.
Yeah, because that's what I was just gonna say. It's tough to say, and most of the people that I know that don't have a negative, I'd say, or like a less than positive outlook on corporate, work for corporate. And it's tough to, I don't know a ton about, how they roll out a corporate that's in full ownership, or when they're transitioning an old owner out and the old owner's still running things. And so I think there's transition periods there where things change a lot. And often when stuff like that happens, or just if the focus is really on production or whatever it may be, then, back to what I was saying earlier, then the person who usually suffers is the patient. And then when the patients suffer, you know, the clinic tries to make things work. And then, if the associates are unhappy, then they leave, or the staff leaves, and there's staff turnover. And then it just starts to create an environment that's not really conducive to ongoing comprehensive care with patients, and just holistic care. It just kind of becomes see a hole, fill a hole. If there's an issue, treat it. And it kind of just, like, that's at least how we've seen it through the system and through school, and how things have just kind of played out. But I could also be completely wrong. I don't have enough experience to know. And I'd also like to hear from, some people who have worked corporate for many years that are pro corporate, and see what their opinion is on that.
But Akil knows, man, you will not find people that will tell you the truth about corporate, because if you talk to the dentists that have gone through corporate and got that fat check, you'll understand that for every person that they refer to, and like to sell their office, they get a cut of it, or they get
Really?
a fat check. Yeah. So you're like, who can I trust here? Because you'll have dentists come on and be like, selling to this corporate was by far the better decision, like best decision I've ever made. I've had 4 kids, but selling to corporate was still the best decision I've ever made. And you're like, okay, how much are they paying you to say that? And like, that they're paying you. And then you go to these dental conferences, and like Akil and I, we were in Ontario at the ODA, and we call it the flea market, because everyone's trying to sell you shit. And you get people pulling you in 3 different directions. Let me introduce you to this corporate. Let me introduce you to, have you met this guy at this corporate? And I'm like, why? Like, why are you trying to introduce me to people working for corporate? No one's ever trying to introduce me to a lab. No one's ever trying to introduce me to a scrub shop. You know what I mean? Because everyone's getting
that like a lot more now.
Tons, man. I get Facebook introductions. Hey, do you think I can get my buddy at Dental Corp to give you a call? Like, I'm going to give him your number. Blah. This could be like the best decision you ever. And I'm like, bro, who the hell are you? First of all, and B, like, don't be giving out my number. Yeah, Kyle, you got my number, but that's by fluke, man. No,
man, I feel like your clinic would not even be like this, the standard like textbook dental corp acquisition clinic. Like it wouldn't. I feel like it just breaks the stereotypes. Like, your clinic's so unique in the way that you just run things, and how it's like, it's just you. It's your personality in a clinic, which is awesome. And I like that. It's different. The dental industry has been the same for so long. I like things that shake it up a bit.
It's all my office manager, Patricia. It has nothing to do with me. I kind of sit on my own side, listening to Drake in my own 3 ops, and running back and forth, trying not to mess up. That's my daily life. Is my blood pressure is high because I'm scared of making my next mistake. That's how I live my life.
But in theory, though,
I hear what you're saying.
In theory, like, corporate is, because I've thought of this so many times. In theory, corporate is sort of like what done, and nobody's cutting me a check. So like, it is all the things that make sense in an industry, right? You centralize a fragmented industry, you let people do what they want to do, which is dentistry, and you pay them well, right? Like, no one benefits from the fragmentation of dentistry other than the people that are selling to the fragmented dentists. But I don't know why or where in execution it's gone so wrong, because it seems obvious, does it not? Like, centralize a fragmented industry. Like, there's a reason why I'd rather go to Costco versus Hasty Market, right? Or like a convenience store. Like, there's benefits to consolidation. There are genuine benefits to consolidation. But I don't know where it's gone so wrong, where every single person in the industry just has this terrible view of corporate.
So what would you do then when you go to graduate and you got a job offer from 2 competing clinics, and they're comparable, or one was even better, but it was corporate? Would you take it?
Well, it depends. I don't have a knee-jerk reaction to corporate, I don't think, because, like, I remember I won't say who said this, but I was at a talk, and I had said, to someone who was representing, a fairly big, body in dentistry, I had said, well, you're so anti-corporate. I'm again not pro-corporate. I'm not anti-corporate. I'm straight down the center. I just look at the facts and sort of I don't really have a side to pick. And I was like, you're so anti-corporate. I've heard you go on and on about how bad corporate is. But what happens when I work for somebody like you and I have a problem with you? Because you're as high as I get to go. You're the CEO, you're the CFO, you're the CMO, you're my boss, you're my dictator. What do I do at that point? And he was just dumbfounded, like he had no answer, right? And so I don't know because I can't make a generalization that all corporate is bad, just like I can't make a generalization that all solo practices are good because I'm sure there's terrible solo practices to work at as a new grad, right? Like I've heard a million horror stories, just like I've heard a million horror stories about corporate. So I truly don't know. I would have to pick it, by the case because I don't really have like an umbrella decision that I've made about it yet, at least. I've also never worked for anybody in a dental capacity, but I don't know, truly.
I feel like one of the big red flags, like I see in addition to that, like just looking at some of the roles like my friends have versus me that I went to school with is um like if I like the position I'm in, if I decide I want to be an associate for life and just, go on cruise control till they sell it off to a corp in the future, and then I kind of just ride off into the sunset or change jobs or stay on, that's fine. But if I want a piece of the pie and I want to buy in and kind of invest into that clinic and help grow it and make it kind of my own as well and be part of that, that's an option I have there. But with corporate, I don't think you really have that option. And unless I'm, wrong, you might work for a corporate and it could be a great job and a great spot in the city that's near your house or anything like that, but you're kind of capped as far as, making it your own and changing things, making it your clinic because corporate owns it, right? So I think that's a
Yeah.
big drawback too. If that's one of the goals you have as a new associate, you're kind of limited there.
I feel like they try to entice a lot of new grads by showing these areas of mentorship and continuing education and will make you an amazing dentist, all while hindering your growth at the same time. I like what as a new grad, you've been out for what, 2 years, year and a half, you said?
Yeah, a year or so.
Year and a half. Like where do you want to go next? Like what's your next course? Like what part of dentistry do you feel like, aside from, like you said before, like becoming more efficient, like what kind of general dentist do you want to be? Like, do you want
Yeah.
to go more into surgery? Do you want to go into cosmetics, endo? Like, what do you want your things to be, man?
Cosmetic is nice. Obviously, I feel like that's, everyone says that. Cosmetic's just nice because it can be very, life-changing for a lot of patients, but so can a lot of things, right? If someone's in a lot of tooth pain and you get them out of that with a nice quality endo and that tooth lasts them forever, that can also make a big difference. But
Dude, you just said the thing that kills all new grads,
what's that?
because that tooth will last forever.
Yeah, not forever, but
And I think no, it's seriously, man. And I don't
yeah,
mean to give you a hard time, but like it comes down to the way that you communicate with patients. And by saying things like that, that's where new
yeah,
grads, including myself, get into so much trouble, is we label these things that like have time values on them and are like, man, I just want to do this and have it last you for years and years and years. And then in the patient's head, oh, it's going to last me for the next 57 years. And then two and a half years later, like the crown
yeah,
breaks right off of the gum line, and then
yeah,
they're at your throat, man. They're at your
yeah.
throat, and you're like, you told me this is gonna last me years and years, and I invested all this money. I don't mean to cut you off, dude. I hear that shit all the time,
No,
and I'm
and you're
like,
not
man.
wrong. And I've made that mistake. Yeah, I've definitely made that mistake before too. In dental school, there was one time that just like stands out the most, where it was one of those exos where you're looking at the rad and you're like, yeah, like you tell the patient like this will be no problem, this will come out easy. And then of course
Oh
that's
yeah.
the case that just
Oh,
you never say that, right? It did not come out easy.
oh,
You're in there struggling forever. So that was when you learn, you're like, okay, that is not it. And obviously, yeah, saying things like it's gonna last forever or like, that went excellent. There's no issues there. It's like you have to be very careful what you say and really have them understand that there's all these different variables that come into the prognosis of any work that you do, and you're trying to get a certain outcome, but there's always variability, and depending on all these factors, how they stack up, it can be, sometimes you're looking at the average of what something might last. It can sometimes last longer than that. And sometimes it can be much, much shorter depending on the case, right? But I think part of it too, back to what you're saying, when you're saying what kind of dentist you want to be and how do you want to learn and stuff, I think it's tough because there's so much to learn out there. And often it's hard or overwhelming when you're a new grad to pick where to learn from, right? There's a lot of CE, a lot of different offers, and every course says it's going to be the best, right? They're going to make you the most competent. They're going to make you have the most successful endos, the most successful implants. And you're like, okay, well, how do I know which one's which, right? When I don't have anything to go off of. So I've been trying to find mentors in my circle as well that can give just a bit of opinion and perspective that isn't, obviously you're going to take CE, that's a given, but even for example, for ortho, right? We've started doing a bit more Invisalign. We're kind of rolling that out, getting connected with an orthodontist that you have a good relationship with and start to build that so you can run cases by them and ask them questions and get their opinion, and have them be honest with you, right? And give you the no BS answer. I think that's important. Same with having, if you had a surgeon or someone like you that has a lot of experience in exos, right, that you can run cases by and ask a few questions with. I think that's huge for sure.
What is the thing you were most underprepared for graduating dental school?
In the immediate term, I think volume of patients and just understanding that, you don't have someone to fall back on, right? When a patient comes in and asks you a question, you can't be like, great question, let me go double check with an instructor, right? It's at the end of the day, it's you. And you're in most cases, you might be one of the younger staff members on your team working as a new grad. So, they're a bit older than you, that you feel like they have more experience, and often they do, right? They've been there for years and they have tons of experience and often have seen way more things in way more cases than you have. But at the end of the day, sometimes, they'll look at you and say, okay, so what do you want to do? And then it's like, oh, right. Yeah, I got to make a judgment call on this. So I think one of the biggest things, and that's something that I definitely, saw coming. I didn't see it going, like, I didn't expect as big of a transition as there was, but throughout dental school, one of the things I really focused on doing was trying to build that independence and always, come to a conclusion or a decision prior to going to ask your instructor for their opinion. Or, if you were going to do work and you were like, okay, I think this crown prep is good, make sure you've done all your checks and that it's actually as good as you think it could be or need before you go get it checked, so that you're not really relying on them as much as possible to carry you through, but just to kind of validate that, the clinical judgment, the clinical calls and decisions you've made to get to that point are sound, or where you might be going wrong and where you need to adjust.
Man, that's a great answer, Kyle. But that doesn't tell me the real truth. I found the hardest part when I was in your shoes was sleeping at night, because I was scared shitless of all the stuff that was upcoming. And you're scared about if your endo will work, and you're scared about the extraction that didn't go that well, or you're scared about the patient you're doing ortho on, their teeth aren't moving and they're already mad at you.
The fear is real, man.
Fear is real, but I find that fear creates the best opportunities to learn, because you're in trouble. And now it's almost like I better learn everything I can about all this subject right now, because I have to know how to deal with this. And it's nice. You're totally right. Like it's sweet, like reaching out to surgeons or orthodontists to be like, hey, what would you do here? But then when you're in that scenario, it's just you. And I found the hardest part, I'd say the first 3 to 4 years out, was like taking on those cases and like sleeping at night. And like, I'm 14 years out, I still have cases every day that wake me up in the middle of the night. Like every single day I'll wake up in the middle of the night and I'll be like, oh shit, I wonder how they're doing. Or am I I don't know if this patient's not healing, they have a huge infection, like should I send them to the hospital, like, or what do I do? What do I do? And I find that tough. Do you ever have cases like that, or am I just crazy?
No, that's every night.
Okay.
Yeah, all the time, man. All the time you're waking up and you're like, oh man, like going through the process in your head. Okay, I did this step, yeah, everything's looking good. And like, a patient that has some post-op sensitivity and pain, you're thinking, okay, well, is there anything I could have done? Can I help them now? Should I call them tomorrow? Like, what can I do? Right. So, one thing that's helped with that, I think, just for my peace of mind, is I do a lot of post-op calls in general on any big case. So if we do a big endo or whatever, calling them that night or the next morning, just checking in, how you doing. It puts your mind at ease a lot. And if there is a problem that's brewing, you can then, jump in and help them, which is nice. So that's made a big
Yeah.
difference, but I don't think I'll ever be able to escape the night terrors, the dental night terrors.
Man, the only thing that helps me through that is Gravol and Benadryl. That
Yeah.
combo puts me to sleep, and I don't care what the hell's going on.
Yeah.
I may have a hangover for 24 hours, but yeah, I'm not even kidding. Like, I don't take both at the same time, but like, I was taking Gravol a lot. Like, because Gravol puts me to sleep instantly, and it allows me to like sleep good for like at least 6 or 7 hours. And there was a point in my career I was taking it every night, and I found dentistry. I know I joke about it, but I found dentistry very stressful. I still find dentistry extremely stressful, and like I get night terrors all the time thinking about patients, thinking if what I've done has made them worse off or better off. You know what I mean? And you don't know how to deal with complications. And you've heard it time and time again. Complications are what will define your career. And I don't want to let complications define my career, because that's what will allow us to go into different parts of dentistry. Like if you have a really bad experience with a set of wisdom teeth, which I hear about all the time from like students in my course, like, they got bit and now they're too scared to dive back in. So then they go into cosmetics and will never take out a tooth ever again. And I just don't want that to be me,
They go into cosmetics, like that's like the ultimate failure. May as well roll over and die at that point, going into cosmetics.
Pulling the tooth, but you know what I mean.
Yeah, I definitely think that's huge too. Like, if you have a case, because you're gonna have cases that go south, like even when you're 20, 30 years out, you're going to have stuff that just doesn't work, right? Dentistry is great, but it's an imperfect science in a lot of ways. And I think like, that's it. It's how you manage those complications. And when you do have a negative, I think you have to learn from it, but you have to also be able to push through and apply that to the next case and make sure that there is a next case. If you just kind of shell up and you don't, especially as a new grad, and you don't try to progress, that can really, have a long-term impact on what you provide to your patients in the future. And I think that's definitely something that's hard, is when you do have a setback, making sure that doesn't just stop there and kind of turn you off of that treatment. But
what's next for you? Like, what do you want to do after you've done your couple of years? Like, do you want to buy in? Do you want to start your own practice? Do you want to move to Ecuador? What's your
I would like to buy in. I think that'd be the first next step here, would be to buy in with them and expand a bit, there. And then I know we had talked a little bit about it in our long-term play. My boss and his wife, so both of them together, they also want to potentially open another clinic, and expand beyond the clinic we're in right now and have another one, maybe do a commercial setup where you have a commercial building. One of those bays is a dental clinic, and then you have, other rental opportunities through there to whatever other healthcare might be, physio, pharmacy, whatever, that kind of thing. You see a lot of that nowadays. So I feel like that's pretty standard for people to say that. But I guess the stepping stone would be to buy in now, still get more experience. Obviously, being out for a year is not really, I wouldn't qualify that as experience at all, right? There's so much to learn, but slowly start building that up, and then eventually hopefully have my clinic, a clinic of my own one day.
Damn, man. What do you think dental school prepared you the least for?
Oh man, I don't know. Like, I guess it depends too. Like, we were talking about this the other day, just with some of some people, and I guess you were a U of S grad, so you might have a perspective on this. But one of the nice things of U of A is we don't have, like, as far as graduate programs, we have ortho, we have perio, but we don't have surgery or anything like that. So our surgical experience and the facilities we have are fairly good, actually. We get pretty good exposure. And I think one area where we don't really get any, our education on is pretty good, but we don't get a lot of clinical touch points on it, is ortho for sure. And perio, we get our rotations through. We don't get a ton of, advanced training in any of that stuff. Like, when we talk surgery, all the surgery that we do is basically exos. Like, that's all that we had exposure to there. A tiny bit of implants. Too, there's so much surgery beyond that too that you can do, right? And we didn't really get any exposure to that. And then implants as well. We got really good training because Dr. Linky was an excellent, he's an excellent instructor in that, and we got lots of good didactic material on it. But the actual clinical basis for it, we didn't have a ton of cases and exposure to it. So you kind of did bits and pieces throughout, right? So like when you had your clinical rotation through your implant clinic, one day you're doing the exam, and then the next, 2 weeks later when you're in there, you might be doing, the restoration or post-op check or whatever it might be. So it's kind of, that's an area too where I think it would have been nice to have a bit more knowledge in. But it's obviously stuff, going forward in your career, you're gonna have to learn so much after the fact with CE and stuff. But those are probably some of the main things. But is that something that you found, I guess, flipping that back on you being at U of S? I've heard that that's partially why it's so awesome, is because they don't have those specialty programs to kind of capitalize some of the cases. You guys get a lot of exposure to that.
I still remember my very first tooth. I pulled a 4-4. I don't know how it came out, but I got it out. And it's one of those things that'll always stick with you. But that was all the surgery I did. Like I think we pulled like 20. I think I pulled like 20 teeth. That was all the surgery I did. I volunteered to have a perio surge done on me, and I had no idea what I was getting into. Yeah, on me. And I had no idea what I was getting into. And I feel so bad for the periodontist. Like, I feel like younger Necky was just an idiot. Like, had no common sense. He did all this suturing of like my lower 4 teeth and yada yada. And like literally one day later, I'm like, it's probably healed. And I bite into an apple. And I'm like, and like just tear everything open. It's bleeding, it's pain. And I was like, what the hell did I just do? And if a patient did that now, I would lose my mind. And yet I'm like almost a dentist, and I still do stuff like that. But that was like the extent of my surgery experience. We just pulled teeth. But I wish I would have got more. Like, I wish we all would have done a soft tissue surgery. We never placed implants at U of S. We restored them, but I heard in U of A, you guys get to place implants, hey?
Yeah, some people, not everyone, which is, the unfortunate thing, but some people do.
How does that work? Why not everyone? Why some?
Just not enough cases and not enough time. They keep it really tightly controlled on what they can do, like, and who gets to do what and how many they do. Because I think, again, a lot of that goes through there's a CE, program there where they do implant, and then there's also our grad, like a GPR. So they get a lot of that as well. But yeah, like our facilities for surgery are awesome. So really good place to learn and do that. But I didn't get to place an implant when I was an undergrad, but some of my classmates did and learned a lot. I think it was with Dr. Lung mostly. I think he's still there. I'm not sure.
Don't feel like you're any worse off or better off, because I can guarantee you at that stage in your career, you have no idea what the hell is going on. And so I don't think that translated into any better of a clinical experience as a dentist. So don't feel bad.
Yeah.
That's awesome. Well, man, it was so good having you on the pod. It's cool to see the perspective of a first year out of dental school dentist, fully licensed dentist, and you have some experience under your wings, and I'm sure you're going to get a ton more. But yeah, thanks for coming on the pod.
Yeah, no problem. It's nice having you guys out. It's also nice hearing from, someone who's still in the system, and then also someone who's got tons of experience, and obviously the dental profession respects a lot, still say that they get dental night terrors. So,
oh man.
Night sweats.
I think honestly, once the night sweats end, you're done as a dentist. Because I feel like, hang it up, because that means that you don't care as much anymore. I truly feel night sweats comes from caring. And it comes from like, hey, I want to do the best that I can for my patient. Did I do the right thing? And until it heals, you'll never know. Or until that infection goes away, you'll never know. Or I guess on the flip side is you just don't want to get in shit either, right? So that's what keeps you up at night too. I don't know.
Fair enough.
Oh man. Yeah, Kyle, you're a good dude, man. Please stay in touch, and thanks so much for coming on the pod.
Yeah, thanks guys. See you around.
Welcome to the Hi, I'm Necky. Is that a sweater?
Yeah, dude, it's the Hi, I'm Doctor sweater. Oh, dude, I see you got yours on too. Looking sharp, bro.
Dude, where'd you get yours from?
It was super easy, man. I just went on to our website, www.hiimdoctor.com. That's HIIMDR.com.
We have a website. We must be raking in cash from selling these sweaters.
Dude, we are killing it. I mean, if that includes losing money on every single sweater that we make, I think we're doing really well.
Yeah, Neki and I are donating all proceeds, which is zero, to charity because we are losing money selling these
I wonder if
sweaters.
the charity will pay us. I think we got something here, man. Let's keep on keep on losing money on every sweater.
Alrighty, guys, go check us out, hiamdoctor.com.
Let's see ya.